I mean, the hope is that, people don't have to go through court-ordered treatment. Unfortunately, we are seeing that individuals do. Over the last 10 years, mental health cases have grown 169%, and we project those will continue to grow. As the need increases, we have a need for additional courtrooms. We've been working with our partners at Valleywise, as well as the urgent psychiatric centers and Mercy Care, to identify what resources we need moving forward. And one of those included to expand the number of beds that are available for these court-ordered treatments, as well as the number of courtrooms that are needed to hear these types of cases. And so this courtroom is a perfect example of the growth that has occurred and the need for additional resources to address those mental health concerns in the community.
The new courtroom is really the culmination of what we envisioned back in 2018 when we bought this building, and envisioned having 192 behavioral health beds and having enough courtroom calendar space to do all of those hearings here within the building. And in February of 20, we opened the first courtroom, and then that has grown to where it wasn't able to manage the calendar needs of the patients here. And we still have 72 more beds to open. So we haven't even fully occupied this building yet. So this really sets the stage for us to be able to, over these next 2 or 3 years, give or take, to open up all the rest of those beds, have the 2 courtrooms here, and to have this be fully functional within the building.
So there's very strict time standards that we need to meet pursuant to statute as far as how quickly these hearings need to occur. And there are a lot of civil rights that have to be protected throughout this process. And so as the number of patients grows, the pressures on the court to meet those timelines and the pressures on Valleywise to meet those timelines, has narrowed. And so this courtroom allows us to ensure that we can meet the increasing demand of the increasing number of patients, to make ourselves accessible, to ensure that they're getting the court-ordered treatment that's necessary.
We really tried to design this in a way within the constraints of the building to make it as easy as possible for the staff to bring down the patients, and I say bring down because all the inpatient units are up above this floor. So we designed it to where there's an elevator that they would use, bring the patients here. There's a waiting area for the patient that's next up for their hearing, and they don't have to cross the waiting area where there might be witnesses or other folks. And we designed it to where the attorneys that represent the patients, known as the Office of Public Advocates, their offices are right here. The county attorneys that represent the hospital in the proceeding, their offices are right here. So it's about as efficient as it could possibly be. I couldn't be more proud of this project overall at the Maryvale Hospital.
We have additional information on the Superior Court of Maricopa County's website. That's superiorcourt.maricopa.gov. If they navigate to the Departments tab, they can find the Probate and Mental Health Department. There's additional information about all of the Title 36 mental health proceedings and applications that can be filed if you feel like someone in your life does need some help and they're going through a mental health crisis.